I have easy extrication with the gurney, and I'm going to go ahead and have my partner hold C-spine to protect the patient. Can you go ahead and hold C-spine for me? All right, thank you. Okay, I'm going to approach my patient and get my general impression of the patient. The patient does not seem to be responding to me. His eyes are not open. He doesn't seem to be alert. Sir, my name's Steve. Sir, I get no response from the patient. I'm going to go ahead and apply painful stimulus. I get no response. I'm going to give this patient a U on AVPU. Okay. At this time, I'm going to check ABCs. Can you go ahead and do the jaw thrust maneuver for me and open up the airway? Okay. All right. Check his airway. I'm checking for any blood, any dental trauma or vomitus. There appears to be none. But I'm hearing snoring respirations. I'm going to go ahead and measure and drop an OPA. Does he accept the adjunct? He does. Okay. So the airway is open, clear, and maintained at this time. However, he's only breathing at 6 breaths per minute, shallow and inadequate. I'm going to have my partner go ahead and ventilate the patient with a back valve mask on 15 liters of oxygen, 1 breath every 5 to 6 seconds. Okay. Now I'm going to check for circulation. Do I see any obvious signs of internal or external bleeding? I don't. Okay. I am going to check the pulse. All right. I've got a strong pulse. I am going to check for capillary refill. Okay. I'm going to check skin signs. All right, I've done my ABCs. At this time, I know this is going to be a rapid load and go patient, so we are going to haul ass to the hospital code 3 after we get this patient on the backboard. But before I do that, I want to do my rapid head to toe assessment. So I'm moving into my secondary. I'm going to start at the head, feeling for decap BTLS, deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, or swelling. Feeling the back of his head for any depressed skull fractures. I'm looking for blood on my gloves. There does not appear to be any present. I'm coming around and feeling the frontal bone. It feels stable and intact. The zygomas, stable and intact. The maxilla, stable and intact. And the mandible, stable and intact. I'm going to open up the eyes. I'm going to check for pearl. Pupils are pearl. I'm going to come down here. Maybe move your hands just a little bit. I'm going to check the ears bilaterally, and I'm looking for CSF or blood. Neither is present. I'm going to check his nose for the same thing. CSF or blood. Neither is present. We can recheck his mouth. Can you do the jaw thrust? Thank you. Okay, mouth is still open, clear, and maintained. I'm going to come down here and check his neck. I'm looking for jugular venous distension or tracheal deviation. Neither is present. I'm going to palpate the clavicle for stability, then the sternum for stability. Okay, I am going to squeeze the ribs, checking for stability. Palpate all quadrants, seeing if it's soft, non-tender. I'm going to go ahead down here to the pelvis, pressing down and in. The pelvis is stable. Lower extremity. Move the boots. Check for bilateral pedal pulses. Come back up top. Check the upper extremities. Check for bilateral radial pulses. Okay. I'm going to have a partner help me to log roll this patient if it's safe to do so. Okay. I'm going to check the posterior, checking for any step-offs of the spine or any decap BTLS, and none is present. We're going to put the backboard behind him, roll him back. That's it. Okay.